We at LAPO are committed to poverty eradication. We equally believe
Good morning and welcome to Bridging the Gap. My name is Patience Nauku Nwanna, and Bridging the Gap is a program that comes to you from Lift Above Poverty organization LAPO. LAPO is a non-governmental, not-for-profit, health-focused organization with a vision of enabling economic prosperity, health for all, gender equity and social justice in Africa. And on today's program, we're going to be talking about a health issue that concerns children, and that is management of pneumonia in children. Pneumonia kills more children than any other infectious disease, claiming the lives of over 700,000 children under age 5 every year, or about 2,000 every day. This includes about 190,000 newborns. And so on today's program, we are going to be talking about this issue, the issue of how we can manage pneumonia in our children. And so we have Dr. Oyakhilome, God's treasure, who will be talking to us about or discussing this issue with us. Doctor, you're welcome to the program.
Thank you very much, ma. Welcome, ma.
You're welcome. All right. Dr. Oyakhilome is a medical officer, and she will be discussing the issue of pneumonia, what is actually pneumonia, and we'll be looking at some statistics as we go on the program. All right, doctor, please can you give us a detailed explanation of what pneumonia is?
Okay, thank you very much. Pneumonia is actually a global body in the sense that it brings about a lot of mortalities, especially to the under 5 children, like younger children, and it's a major concern for the World Health Organization, like in general, because of the high mortality rates. So I will just quickly go into the explanation of pneumonia. Pneumonia is actually a disease of the lungs, which is caused by microorganisms, which give rise to inflammation of the lung tissues. And there are several microorganisms that can cause this. It could either be fungal, it could either be bacterial, it could either be viral. So I'll go straight to the presentation, how the child will present. The child will usually present with cough. The child may also present with fever. The child will present with difficulty with breathing. The child will also present with fast breathing. So in these cases, when the child presents at the hospital, we manage. There are special ways in which we manage these children, which I will explain further later. And there are several risk factors that comes with this, which includes overcrowding, malnutrition. We can also talk about air pollution, poor ventilation, poor hand hygiene. Also, we can also talk about poor hand hygiene in the mothers. We also talk about breastfeeding. People that they are children that are not fully breastfed, like over 6 months. So also children that are poorly immunized.
How common is pneumonia in Nigeria?
Like I said earlier, pneumonia is a global health issue. In Nigeria, it accounts for a lot of mortalities.
Okay,
according to
both adults and children.
Both adults and children, it accounts for a lot of mortality. Because there are types of pneumonia, like there are 2 types of pneumonia, like the lobar and the bronchopneumonia. According to UNICEF gave a value of about 800,000 per year. Then generally, in general, there's a whole lot of deaths from pneumonia because of the poor management and because of the poor management and because of the level of the socio-economic status of the individual. And also, since the inception of COVID, pneumonia has become very common, and the treatment has become much more commoner in hospitals currently.
Can we still
talk
about the risk factors? Let's break down the risk factors. We talked about malnutrition.
Yeah, there are several types of risk factors. I'll start with malnutrition. Okay. When a child is malnourished, the immunity is down. Okay. Because that's why we always advise mothers, please feed your child well, because these nutrients from food helps to boost your immunity. So when a child is not eating well, the child is at risk of this infection, because the immunity is down. It affects children with low and poor immunity, like immunocompromised. Then also children that are not fully breastfed, like some mothers who just breastfeed their child for 1 month, 2 months. Ideally breastfeeding, they didn't do this exclusive breastfeeding. This exclusive breastfeeding gives a form of immunity to the child. it boosts the child's immunity. But when you don't breastfeed the child to that extent, the immunity, it's just like the child does not have enough immunity to fight against these diseases. Then also ventilation, like in an airtight place. You see some families, that's why I talked about socio-economic status. You see some families, there are like 12 children living in one room with adults, so there's a high risk of them getting these infections too. Then for people that are living in polluted environments, air pollution is also a very major factor, like those that live around these factories, asbestos and the rest. It's also a very high risk factor. Then for parents that are smoking, it's also a very high risk factors. Then for children that are born premature too, because when children that are born premature, their lungs will not be fully developed, so it can give rise to that. Hygiene also is also a major factor. When the mother is not neat, they are not keep observing proper hygiene. Then children that are not immunized, you don't immunize, they just do some immunization, like do half. A child that is fully immunized for age will not have all these kind of issues. So immunization is a very important factor.
All right, we've been talking about pneumonia in children, how you can manage pneumonia in children. Okay, doctor, let's look at how do you prevent it before we go into the management.
There are several levels of preventions in medicine. The major one, the level of prevention, there are about 5 levels, and the major one I'll be hitting on is the first 3 levels. Under these levels of prevention, there's a general health protection. This general health protection, just like I'm talking now, is the one that involves the government.
Okay.
Just like it involves the government and the non-governmental organizations. They go out there to the marketplace, they talk about the prevention that, mama, please, people should try to stay in spacious environments, don't smoke around your children, if your child is hot, take him to the hospital. That general health empowerment, like we are going to the level of the markets, their business places, their school, their sensitization, and all that. That's the general health. Then also I will not go to the specific health protection is the one that when the patient, when we are talking about breastfeeding, we are encouraging mother, please, you have to breastfeed your child, don't do half breastfeeding, do the exclusive, because that exclusive breastfeeding will give the child a immunity that will help the child to fight against some of all these infections. And again, another one is the hygiene. We have to also be able to tell the mother to encourage mother to be more hygienic with her feeding practices, her cooking practices, and the rest of it. Because when there is no hygiene, it still fosters the infections to breed more. Then also the immunization aspect. We want to encourage mother to immunize their children fully. Immunization is actually free, so we should encourage the mother that immunizing a child will not cause the child any harm. It will actually help your child, to actually help to boost the immune system. Then the third level of prevention, I'll be talking, I'm going to stop at the third. We are actually 5, but for the purpose of this teaching, I'm going to stop at the third level. The third level is the early detection and prevention. The thing is, when you detect something at a very early stage, it is very easier to manage than when the thing has already gone very bad. It's not like when it goes by we can't manage it, but it will now come with complications. It will now come with a lot of complications. So when a child presents, when a child presents, the child is coughing, the mother will say, let us do this, or no. It's better to present early presentation, and early management will prevent all those complications. So when a child presents early, we know there are some certain things we do to minimize the pneumonia.
All right, thank you so much, doctor.
Thank you
for coming on the program. I've been talking about management of pneumonia in children. And pneumonia, like we said at the beginning of the program, kills more children than any other infectious disease, claiming as much as 700,000 children, lives of children under the age of 5. And so we are going to take some statistics now on pneumonia. All right, we have air pollution as a contributing factor to about 30%. That is 749,200 of all pneumonia deaths in 2019. We have 56%, that's 422,800 from household, and 44%, that's 326,400 from outdoor sources. We have here that about 40%, that is 304,200 of air pollution related pneumonia deaths are among children under 5 years, and 70%, 210,400 from household air pollution. Again, we have 40 low and middle income countries, including Nigeria, as home to 90% of all air pollution related pneumonia deaths. That's about 656,400 deaths. India tops the charts with the highest number of overall air pollution related deaths, while our dear country Nigeria comes second. I'm talking about giving us the global figures when you talk about when you're talking about pneumonia, and so we want to look at the way forward, or what can we do to reduce the burden of pneumonia deaths in children. I have here raise awareness. We need to raise awareness about pneumonia among leaders, decision makers, and even health providers. Again, you need to educate the public. You educate the public to recognize pneumonia and seek proper treatments. You can also do as much as focus resources on this neglected disease to ensure that pneumonia is, or it becomes, a policy priority in our health agenda. And so I encourage you finally to be an ambassador today in the fight against pneumonia, especially pneumonia in children. That's where we will draw the curtain on this program for today, and we hope that with this, a lot of parents will be able to take their children to the hospital, especially when you notice that they are coughing. The cough is not going. The cough is persistent, and you also notice that your child is running temperature, your child is not breathing fine, is not breathing well, and there is fast breathing. Please take the baby or the child to the hospital, and we hope that by this program you will be able to overcome or be an ambassador of pneumonia, the fight against pneumonia in children, or the fight against pneumonia in Nigeria. And that's where we end this program for today, till we come your way again next week, Saturday. Right, bye.